Hey everybody, this is Dr. Langdon, board certified pediatrician, mom of 6, grandmother to 2, and also a lecturer sometimes at local medical school where I'm the chair of pediatrics. And today I was doing a talk about congenital heart disease and had sort of a neat flashback in time when I remember memorizing this stuff when I was in medical school, which was a very long time ago. So I would have had my didactic stuff. The way we did it at Duke was all of basic sciences was in the first year, so it would have been somewhere between 91 to 92 when I was learning this information. And I recall having a memory device for the cyanotic congenital heart disease lesions, meaning that the baby would be blue. So when the babies are blue, it's because if the blood is going through a defect, it's going from right-sided circulation to left. When the babies have a defect in which it goes from left to right, those lesions are acyanotic. Well, anyway, I was recalling and shared with my students today that we had this cool little trick that we did. And it's basically just remembering 1, 2, 3, 4, 5. The 1 is for truncus arteriosus, meaning that the two primary arteries leaving the heart are sort of joined together. And where the septum is supposed to septate, it doesn't do it properly. So you know how haters are going to hate? Well, septums are supposed to septate, but when they don't, it's a problem. And that results in truncus arteriosus. So one trunk, one artery, bad. That's a cyanotic lesion, a bad lesion. And then 2 is transposition of the great vessel. So that is those two primary arteries leaving the heart flip around. That's also a problem. So transposition of the great vessels, and then that's a 2. And then the 3 is tricuspid atresia, and then the 4 is tetralogy of Fallot, and then the 5, this is a bit of a stretch, but it's total anomalous pulmonary venous return, and that's got 5 words in it, TAPVR, so that kind of makes a 5. And then, of course, now while we talk about hypoplastic left heart syndrome and obviously persistent pulmonary hypertension, but for the ones that are harder to remember, those top 5, you can just remember as 1, 2, 3, 4, 5. And the reason it was so cool is that I remembering it that way 30 years ago over 30 years ago. Yeah, 91, sorry. That'd be 32 years ago. Lord have mercy. When I was a student in medical school myself. It was just neat to think about.